So hey everyone, welcome to Core Vet. So today we are going to start with the cephalosporin, which do come under the beta-lactam group. We had already covered the penicillin. You can watch out the penicillin for that, right? So today we are starting with the cephalosporin. So I had discussed that too, that the cephalosporin do contain a beta-lactam ring. Okay, so let's start with the general information about the cephalosporin and its structure, right? So if we talk about the structure, okay, so in the penicillin, there was what? In the penicillin, there was what? The thiazolidine ring, right? In the penicillin, there was thiazolidine ring in the structure. But in the case of the cephalosporin, what's the difference is that in the case of the thiazolidine ring, there is what? The dihydrothiazine ring, right? So there isn't any thiazolidine ring. Instead of the thiazolidine ring in the structure of the cephalosporin, there is what? The dihydrothiazine ring, right? So if we talk about the cephalosporin, from where does the cephalosporin has originated? What is the origin of the cephalosporin? So the cephalosporin was first obtained from the Cephalosporium acremonium. Okay, so you should remember the particular name from where the antibiotics has been obtained, because they do come in the Phillips and the multiple choice question. So you should just remember that from where the antibiotics has been obtained. Okay, so if we talk about the cephalosporin, so the cephalosporin has been obtained from what? Cephalosporin has been obtained from the Cephalosporium acremonium, right? And the semi-synthetic derivatives, if we talk about the semi-synthetic derivatives that we will discuss in the classification too of the cephalosporin. So the semi-synthetic cephalosporins has been derived by making the substitution in the 7-amino-cephalosporinic acid, right? The 7-ACA. See, the thiazolidine, your dihydrothiazine ring and the beta-lactam ring together known as what? 7-amino-cephalosporinic acid, right? 7-ACA, right? So whenever we are going to make any substitution in the what? 7-ACA, it will lead to formation of what? The semi-synthetic derivatives of the cephalosporin, right? And the antibacterial activity or the spectrum of the cephalosporin could be altered by making changes at the seventh position that is there in the beta-lactam ring. Okay, so you should remember this particular part, that the spectrum of the activity could be altered by making changes at the seventh position in the beta-lactam ring, right? And the third position is also important, and which is due to, as it is associated with the pharmacokinetic property of the cephalosporin drug. Okay, because the third position that is there in the dihydrothiazine ring, it is related to what? It is related with the pharmacokinetic properties, right? So this you have to remember, that the positioning, which position is associated with what purpose, right? Because they may ask. Okay, so the third position is associated with what? The third position of the cephalosporin is associated with the pharmacokinetic property, right? So if we talk about which was the first cephalosporin that has been discovered, the first cephalosporin that is discovered named as Cephalosporin C, and consecutive to the Cephalosporin C, Cephalosporin P and etc. has been formed or discovered, right? If we talk about what's the difference between the cephalosporin and the penicillin, we know that the penicillin G, the benzyl penicillin that we had discussed in the penicillin lecture, we know that the penicillin G was what? Thermolabile and acid labile. So what does the thing made a difference between the cephalosporin and the penicillin is, the cephalosporin is more water soluble, more stable in acid, and more temperature stable, means thermostable, as comparison to what? The penicillin. And the penicillin was quite susceptible. Okay, that's why we are using the penicillin, or we are administrating generally the penicillin through the intramuscular route, right? And if we talk about in the structure of the penicillin, if you remember that there was only one site which is named as R1, but in the case of the cephalosporin, we have two sites, R1 and R2. Let me just show you the structure once again. So you can see here that R1 and R2, two sites are there, while in the structure of the penicillin, we had just only one site which was R1, right? So if we talk about in the 7-ACA molecule of the cephalosporin provides more site. I had told you that R1 and R2 are extra sites, right? The R2 is the extra site as comparison to the penicillin. So for the chemical manipulation, you get an extra site. Okay, so the more and more semi-synthetic cephalosporin could be produced, right? Because you are getting an extra site to make an alteration in a certain compound. If you have a certain extra site for a compound, so you can make several alteration in that particular compound, right? So if you are able to make several alteration in a certain compound, then it will make it more to just prone to just have a more and more semi-synthetic compound, right? Because there are extra site, right? So let's just move further. So if we come on to the classification, so let me tell you, there in total we are going to study about the 5 generation of cephalosporin, right? Cephalosporin, there are 5 generation of the cephalosporin, and one thing you should remember, as you pass on to the from one generation to the 5th generation, from the 1st generation to the 5th generation, so the activity towards gram negative organism and the spectrum increases, right? So as you move further in the generations from the 1st to the 5th, the activity towards the gram negative and the spectrum do increases, right? That's one thing you should remember before studying the classification, because in the classification obviously you have to mug up the names. Okay, so if you are going to just have a certain pattern, it will make it much more clearer and easier. Okay, so if we talk about the 1st generation, okay, so I had divided the 1st generation into 3 types. One is the O, P, and IMM. So the IMM refers to the intra memory route, right? Intra memory route. P represent parental route and O represent oral route. Okay, so that's what about the OP and IMM is. Okay, so these are about the routes from which routes the 1st generation drug has been administered, right? Similarly, I had written in all the generation. Okay, so if we talk about the 1st generation drug that has been given orally, you can remember just 2 names. Okay, I had written many names so that you can have a choice between among them. Okay, you can have a choice among them, because the classification of the cephalosporin do come to write in a descriptive answer in your examination, right? For sure, in the final examination, there are chances that the classification of the cephalosporin could be asked, right? So you should remember that you can just remember 2 or 3 examples from each segment of the generation, right? Means 2 example from the oral, 2 example from the parental, and 2 example from the intramemory. Okay, so if we talk about the 1st generation, so in the 1st generation, your cephalexin, cefadroxil, cephaloglycin, and cephaloridin. Okay, these are the oral. Now cefazolin, cefapyrin, cephalothin, cephaloridin, and cephaloinium. Okay, these are what? These are the cephalosporin that are given through parenteral route, right? Now if we talk about the 1st generation drug that are given through the intramemory route, these are the cephaacetyl, cefapyrin, and cephalonium, right? Cephalonium could be given parentery as well as the your intramemory route. We talk about the properties of the 1st generation drug. These are highly active against the gram positive and less against the gram negative. I had told you, as you are going to further pass on through the generations, the gram negative activity and the spectrum both are going to be increased, right? So if we talk about, for these are generally used for the infection of the bones and the soft tissues, and these are known as the what? Cephalosporin. Why they are known as cephalosporin? Because they are active against the Proteus, E. coli, and Klebsiella. Okay, and these are not for the pseudomonas like the sulfonamides, right? These are not for the pseudomonas, not for the enterococcus, enterobacter, and indole positive Proteus, right? Now coming on to the 2nd generation of the cephalosporin. So if we talk about the oral administration, so cefaclor, cefioxime acetyl, okay, cefioxime acetyl, and cefprozil. Okay, cefprozil, cefioxime acetyl, and cefaclor These three are the orally administered second generation cephalosporin, right? And the first generation was discovered in the 1960 and second generation was discovered in the 1970, right? If we talk about the cephalosporin of the second generation that are given through the parenteral route, they are cefuroxime, cefoxitin, cefamendol, your cefonicid, and ceforinide, right? These were the parenteral route. These were through the parenteral route. If we talk about the through the intramammary route, it is your cefuroxime, right? If we talk about the general properties of the second generation cephalosporin, so they are known as hen cephalosporin. Why so? Because they are active towards the Haemophilus, Enterobacter aeruginosa, and Neisseria. Okay, likewise, the first generation was known as the PEC due to its activity towards the Proteus, E. coli, and Klebsiella. Similarly, the second generation is known as the hen cephalosporin. Okay, because they are active towards what? Haemophilus, Enterobacter aeruginosa, and Neisseria, right? They are relatively resistant towards the beta-lactamase enzyme, right, as comparison to the first generation. If you are going to compare through the first generation, they are more relatively resistant to the beta-lactamase, right, and having the similar spectrum as that of the first generation, and they are active against the gram-negative 2 like Enterobacter, E. coli, Klebsiella, and Proteus. They are weaker than the first generation as comparison to the when you are going to compare for the gram positive activity, so they are quite not that much but comparatively weaker than the first generation. Okay, so that the point you have to remember. Now coming on to the third generation, it is quite important because the majorly in the clinics that the third generation that is used. If you are talking about that in the third generation, there are two routes that we are focusing on. First one is the oral and second one is the parenteral, right? In the oral route, there is cefixime, okay, cefopodoxim or proacetyl, right? Cefdinir, ceftibuten, and ceftamet pivoxyl, right? These are what? These are given through the oral route, right? If we talk about the parenteral route, these are what? Cefotoxime, cefotoxime, you can remember through cefotoxime, okay, ceftizoxime, okay, ceftizoxime, ceftriaxone. Ceftriaxone is generally used in the clinics and it came through the name of the monosef. Okay, when you are going to the clinics, you can just see that the monosef has the composition of the ceftriaxone. Okay, so ceftriaxone is there, okay, ceftazidime is there, and cefoperazone is there. Now, what's the property of these parenteral route? Parenteral route are generally used in the clinics. Okay, so the ceftizoxime is used for the anaerobic bacteria, right? And if we talk about the ceftriaxone, it is used for the gonococci anaerobic, and there is the one thing that it is excreted by both the renal and the bile route. Okay, if we talk about the ceftazidime, so the ceftazidime is Pseudomonas aeruginosa effective. Okay, similarly the cefoperazone also. Okay, and if we talk about the general property of the third generation cephalosporin, so these are having a high affinity, okay, high augmented activity against what? The gram negative. However, they are less active on the gram positive cocci and anaerobe, right? I had told you the activity towards the gram negative increases as we are going to pass on to the next generation. Okay, so all are highly resistant to the beta lactamase, okay, that are from the gram negative bacteria, and they have the ability to cross the blood brain barrier, right? Coming on to the fourth generation cephalosporin. So the fourth generation cephalosporin example are cefepime, cefpyrone, and cefquinone, right? These are the example of the fourth generation, and all are given as parenteral. Okay, they are also known as what? Anti-pseudomonas cephalosporin. So the spectrum is same as that of the third generation. Okay, and many of the fourth generation cephalosporin is in the zeta ion form and can penetrate the outer membrane of the gram-negative bacteria. Please remember this point, right? If we talk about the fifth generation, in the fifth generation, the ceftaroline and ceftobiprole. These are the two examples you have to remember for the fifth generation, right? And they are designated as the cephalosporin with the anti-MRSA activity, right? They are known as the cephalosporin with the anti-MRSA activity. Okay, MRSA means methicillin-resistant Staph aureus, right? Okay. Now, okay, I hope this particular part is clear. Now, I had told you in the penicillin itself that there is beta-lactamase, which is cephalosporinase, and the penicillinase, both are beta-lactamase. Okay, they are going to split the particular beta-lactam ring, and in the penicillin, it led to formation of the penicilloic acid, and in the cephalosporin, it is going to lead to the formation of what? The cephalosporanic acid, right? The part is clear. Okay, if we talk about the mode of action, you can refer the penicillin video for the mode of action, and it is quite similar to the penicillin. I'm not going to discuss it over here. I will give rather the link in the description itself. You can just refer that particular video to look for the mode of action, right? So let me move forward for the clinical use. So if we talk about the clinical use, the first generation could be used as the alternative for the penicillin G, because they are what? The thermolabile and acid labile. Okay, so the penicillin G was thermolabile and acid labile. So it could be the first generation cephalosporin could be used as an alternative for the penicillin G, right? In the staph infection, right? Like the cephalexin could be used. Okay, and they are also used as the surgical prophylaxis like cefazolin. Okay, ceftriaxone, if we talk about the ceftriaxone, it is used in the bovine bronchopneumonia, and also which is caused by the Pasteurella multocida and Pasteurella hemolytica, right? And also used in the UTI infection that is there in the dog, right? Now, if we talk about these particular cephalosporin, they are highly effective for the treatment in the soft tissues, bone. In the case of the meningitis, it could be used. In the case of the osteomyelitis, it could be used. In the case of the prostatitis, arthritis, and as I had told you, in the urinary tract infection also, right? If we talk about the cefapyrin benzathine, in the case of the dairy cow, and cefapyrin sodium are used for the treatment of the mastitis in the case of the dairy cow, right? So cefapyrin benzathine and cefapyrin sodium, right? So this was the clinical use of the cephalosporin, right? Now coming on to the side effects, because the side effects are the thing that you have to look for before prescribing any drug. So it is mandatory to know about the side effects or the adverse effect of every class of drug, because in examination also, along with the classification, they are gonna ask you about the side effects, because side effects are quite important but while judging a certain class of drug, while you are prescribing a certain drug. Because if you aren't having a sound knowledge regarding the adverse effect of a class of drug, then how you are gonna treat a patient well, right? Because to treat a patient in a nice way, you have to have a quite a sound knowledge regarding the adverse effect of each class of drug, because several drugs are contraindicated in several animals, right? So you should be focused regarding that, right? So if we talk about the side effects, so it is relatively non-toxic, and some are nephrotoxic like cephaloridin and cephalothin. Some are nephrotoxic too. Okay, so the IM injection is painful and irritant, and outside the vein, if you're gonna just puncture the vein and just the syringe past the vein itself, then it may lead to the condition of the thrombophlebitis, right? And hypersensitivity is also there. Okay, so the patient that are allergic to the penicillin, okay, so hypersensitivity could be felt in this particular case also, and the super infection with the pseudomonas or the candida could be there. And cephalosporins like cephapyrazone, ceftriaxone, and cefamendol, moxilactam I'll discuss it later because it do come under the your beta-lactam group. Okay, they cause like warfarin, like hypoprothrombinemia, right? Because if you had studied about the systemic pharmacology, you must have studied about the warfarin, because warfarin is taught in the cardia part, and warfarin even is taught in the toxicology also. So if we will discuss the toxicology, I'll tell you about in the deep about the warfarin too, right? So the warfarin will lead to the conditions like hypoprothrombinemia. Okay, so these particular cephalosporin that I had named earlier, like cefapyrazone, ceftriaxone, cefamendol, and the moxilactam, they all act in the way similar to the warfarin and lead to the condition like hypoprothrombinemia, right? And lead to what? It lead to the prolonged clotting time. Now, one thing you should remember, that aminoglycoside, okay, are incompatible with the cephalosporin when they are mixed in a same syringe, right? Okay, you should not give aminoglycoside along with the cephalosporin, because sometimes what the people do, they mix the aminoglycoside and cephalosporin all together in the same syringe. Okay, it will lead to the inactivation of the compounds. It won't be effective then. Okay, so always when you're giving the aminoglycoside along with the cephalosporin, so you should keep those particular drugs in a separate syringe and apply separately. Okay, you should remember this particular point. It is of clinical importance, right? So remember that the aminoglycoside and the cephalosporin should be injected through the not through the same syringe, through different syringe. Okay, because it will lead to the inactivation, right? And also when you are giving the aminoglycoside along with the cephalosporin, you should look for the kidney physiology of the particular patient, because it is necessary the kidney function should be proper, because if the person is already having a kidney failure or a disease condition regarding the kidney, so you should look for that whether the, because I had told you that in the general too, that what factors affects the choice of the antimicrobial. Okay, in the general I had told you that what are the various factors that you should look for before prescribing any drug, right? So you should look for that whether while you are prescribing, what is the condition of the patient, right? Because when you are giving, because aminoglycoside are also nephrotoxic, ototoxic, okay, and do have a curare like action due to the neuromuscular blockade. Okay, I will discuss in the, when I'll be discussing about the aminoglycoside, I'll discuss about these following points, right? While currently you should remember when because the aminoglycoside and cephalosporin altogether can potentiate the nephrotoxicity. Okay, I hope this particular part is clear. Now coming on to the cephamycin. So cephamycin, it is chemically related to the cephalosporin. There isn't much difference, but what's the difference is, I had told you the alteration in the spectrum could be made by making a change at the 7th position at the beta-lactam ring of the cephalosporin, right? So you could look that in the cephamycin there is a methoxy group at the 7th position. Okay, I had told you that the alteration could be made while making a change at the 7th position of the beta-lactam ring. Okay, so if we talk about the cephamycin, they have been obtained from the streptomyces, and some example of the cephamycin which are naturally obtained are the cefametazole and cefotitan, right? And they have property as similar to the second generation cephalosporin, right? If we talk about the synthetic cephamycin, so it's the moxalactam. Okay, it's the Beta-Lactam. Okay, and the properties are similar to the third generation cephalosporin. Now coming on to the several beta-lactam that has been remained, because you have to have the knowledge about all the beta-lactams. So the next beta-lactam if you talk about is the monobactams. So example of the monobactam is azithromycin. So what it will lead to? It will lead to the inhibition of the gram-negative enteric bacilli like Haemophilus influenza and Pseudomonas. Right, it is not for the gram-positive cocci and anaerobes, and could be used in the patient that are allergic to the penicillin and the cephalosporin for the treatment of the urinary tract infection, gastroenteritis tract infection, and the respiratory tract infection. Right. We talk about the carbapenems. So the example of the carbapenems is the imipenem, right? And these are extremely potent and having a broad spectrum beta-lactam activity. Okay, have a broad spectrum along with the extremely potent activity. Okay, these are for the gram-positive cocci. Enterobacteriaceae means the all the E. coli, Klebsiella, Proteus and all. Okay, Pseudomonas aeruginosa is also effective. Okay, is also gonna have an setback with the carbapenems. Okay, so the Pseudomonas is also gonna affected by the carbapenems, right? Listeria and several anaerobic bacteria, right? So one thing also that it is resistant to the beta-lactamase, right? So if we talk about the carbapenems now, so one part that you have to remember about the carbapenems is that there is an enzyme, namely dihydropeptidase, right? So this particular dihydropeptidase is found in the brush border of the renal tubular cells. So what happens, this particular carbapenems is getting hydrolyzed in the presence of the dihydropeptidase 1. So what we do, we combine the carbapenems along with the colistin in order to have an inhibition of the dihydropeptidase 1. Okay, that's why we combine carbapenems along with the celastin, right? So these are generally used in the patients that are affected with the AIDS and the cancer, or which are immunodepressed, right? So this was all about the cephalosporin and other beta lactams. So thank you everyone.